there is supposed to be an odor that comes from your vulvovaginal area. But how do you know when the odor that you are perceiving coming from this area is normal and when it's not? In this video, I will guide you through all the different vaginal odors that exist. And for those of you who stick with this video right through to the end, I have a special and bonus piece of information about a rare type of vaginal odors that all women should know about. And I will also address at the end of the video, based on the different characteristics of your vaginal odors, when it is that you should be consulting with your doctor. Hi ladies, I'm Dr. Katie. I'm a board certified family doctor. Welcome to Hey Doc. On this channel, we address health topics, but in particular, we are absolute passionates for women's health and fertility medicine. So if this type of content tickles your fancy, do consider subscribing and make sure that you check out some of the many other videos that we have right here on this channel. The odor that you get coming from your vulvovaginal area is influenced by the pH of your vagina. The pH that is found in the vagina is typically slightly acidic, ranging from 3.8 to 4.5. The bacteria species called lactobacilli is to thank for this pH that is found in the vaginal environment. The more acidic the pH of the vagina is, the more offensive the odor will be. Also, another thing to say about an acidic pH in the vagina is that it is associated with reduced fertility. The more acidic the pH of the vagina is, the more it creates a hostile environment for the sperm cells. So what will happen is some of the sperm cells will not even be able to swim to get into the uterus because the acidic pH would have affected their mobility, and many of them will die within the vagina, never having made their way through the cervix and into the uterus. Now, although lactobacilli is the main species of bacteria that is found in the vagina, there are other diverse types of bacteria, fungus that are also found in the vagina. And all of these collectively are referred to as the vaginal flora. A well-maintained and balanced pH is important for preventing infection, which themselves will lead to strong offensive vaginal odors. Now, this very delicate pH balance is very easily distorted by things like pregnancy, being on antibiotics, using vaginal douches for self-care, the use of lubricant, and at times urinary tract infections. Before we consider all the different abnormal vaginal odors, let's talk about the kind of vaginal odor that you should not worry about because it's normal and expected for you to have that specific odor. A slightly tangy, sour, or some may describe it as a yeasty type of odor is associated with the presence of good bacteria. Remember, lactobacilli, which we want. The other thing to note about this attempt to describe the normal vaginal odor is that it's quite subtle. You may or may not smell it at all, but it's not something that will be distinct, and you certainly shouldn't be bothered by this odor. The take-home message for this part of the video is that your vagina will have an odor, but that odor should not be a flowery or strawberry or even less a vanilla type of odor. Stay away from any product that promises to turn your vagina into an environment that has this type of odor. Stay clear of these products because they will affect this very delicate and important pH balance. Now, on to the reason why you clicked on this video. The most common cause of vaginal odor has to be my number one for this video. That is bacterial vaginosis. The underlying cause of bacterial vaginosis is quite simply that the pH balance has been disturbed. It leads to this very strong fishy smell that comes from the vulvovaginal area. Very often patients will describe the fact that they can smell this just fishy smell coming through their clothes. And what tends to happen is that once a woman has had bacterial vaginosis before, when she gets it again, she knows. The fishy smell that occurs in bacterial vaginosis is often intensified after sexual activity for reasons we don't quite understand. Now, ladies, bacterial vaginosis is not an STD, although it is a condition that is seen in sexually active women. So we refer to this kind of infection, although it's not an STD, but it is a sexually associated condition, but not an STD. So that means that you cannot transfer it to your partner, and he in turn cannot catch it from you and transfer it to the next person. But hopefully there won't be another person if he's your partner. If you get what I mean. Hopefully you are the only one that he's with. Sometimes bacterial vaginosis can also be associated with a grayish, whitish discharge. Practices like vaginal douches increases your risk of developing bacterial vaginosis. Therefore, avoid vaginal douching at all costs. However, if despite your good behavior and you being intentional about looking after your vaginal pH, you still somehow develop bacterial vaginosis, don't worry. It's very easily treated with metronidazole or clindamycin. And both of these drugs either come in an oral formulation or the cream, a cream that is inserted inside your vagina. Remember, ladies, I'm Dr. Katie, but I'm not your personal doctor. So do make sure that you seek the advice of your own clinician. The second cause of vaginal odors has to be Trichomoniasis infections. Trichomoniasis is an infection that is transmitted through sexual contact and attributed to the transmission of a parasite. Trichomoniasis infection will give you an odor like bacterial vaginosis, this very fishy odor. And with trichomoniasis, sometimes some patients have described the odor as a musty type of smell. With trichomoniasis though, it is very often associated with a green or sometime grayish frothy discharge. So I'm sensing that some of you ladies might be a little bit confused. You may be thinking, well, bacterial vaginosis is a fishy smell and trichomoniasis infection is also a fishy smell. How am I able to tell which one I've got, especially with the fact that one of them is an STD and the other one is not an STD? Very good question. I would say if you get this fishy type of odor with or without a discharge, if you have never been sexually active, there is no way that it's going to be a trichomoniasis infection. However, if you have or are being sexually active and you are getting this fishy smell, especially if you've never experienced it before and you've had a new sexual partner or multiple sexual partners, I would say go ahead and get it investigated. That means you need to see your doctor, get a high vaginal swab done, and the results will be able to confirm whether we are dealing with bacterial vaginosis or a trichomoniasis infection, or both. Now, if the result confirms that there is a trichomoniasis infection, it wouldn't be such a bad idea to do a full STD screen, because trichomoniasis as an STD can coexist with other STDs. And remember, a high vaginal swab will only identify trichomoniasis or bacterial vaginosis. It will not identify other STDs. Just a word of caution for you ladies who have had bacterial vaginosis before and you get this fishy smell and you go to your doctor and say, I know I've got bacterial vaginosis, give me metronidazole or clindamycin, I know what this smell is, just treat me. I don't need to be investigated because I know what this is. I can understand why patients do that. And you know, the first time, the second time, it's okay. But if you get this smell happening over and over again, despite the fact that you were treated with the appropriate antibiotic, you should start thinking outside of the box. You should consider doing a full STD screen, which will also include a high vaginal swab, because this fishy smell that you've been getting and that you're so used to because you feel that you've had bacterial vaginosis so often may not be bacterial vaginosis, but rather trichomoniasis. And remember, delaying the treatment of trichomoniasis can lead to infertility. Now, if your results comes back as positive for trichomoniasis, other tests that your doctor should consider testing you for include chlamydia, gonorrhea, mycoplasma, and if you are concerned that the person you have been with may not be as faithful or you're doubtful about their sexual history, I would strongly recommend that you also do tests for blood-borne STDs such as HIV, hepatitis, and syphilis. Trichomoniasis infections are treated with the antibiotic with either metronidazole or tinidazole. And remember, finish the full course of the antibiotic treatment prescribed. Often what happens is women start these antibiotics and the smell that they're perceiving settles and they do not finish the course. That is what causes the infection to reoccur. And for trichomoniasis, as I previously mentioned, it is associated with infertility. So if you've been diagnosed with it, you must make sure that you complete the course. And 4 to 6 weeks after completing the course, go back to see your doctor and do a test of cure. So get tested again, and the result of the test of cure should be negative. Also, remember that if you have tested positive for trichomoniasis, your partner should also be tested and he should be treated at the same time as you, and you should both abstain from sexual intercourse until you have both completed the treatment. Many women at some point in their lives have experienced this very yeasty and fermented type of smell. Can you guess the cause of it? Sure you can. It's due to vaginal thrush. It's associated with vaginal itching, plus or minus a thick white pasty type of discharge. Vaginal thrush happens when the small amount of Candida albicans that is normally found within the vaginal flora starts to overgrow the good vaginal bacteria lactobacilli. The pH balance is disturbed, and there you have it, vaginal thrush. Yes, when you are on your period, you will notice a metallic type of odor coming from your vulvovaginal area, but as well as from your pad or your tampon. This metallic odor, which some have described as a copper type of smell, comes from the fact that iron is found in the red blood cells that essentially constitute the blood that is coming out of you and onto your pad or onto your tampon. Let's not forget the very obvious cause, poor hygiene. Poor hygiene leads to vaginal odors because it causes the accumulation of unwanted bacteria, as well as the accumulation of the shedded dead cells that come from within the vagina and the vulvovaginal area, together with the buildup of other microorganisms. When the odor that you are getting is due to poor hygiene, you will perceive a very robust and earthy type of odor, and this odor will have a sweetish tinge. Poor vaginal hygiene leads to vaginal odors, not only because of bacterial overgrowth, but also due to the fact that the genital area is prone to sweating, especially in warm, very hot and humid conditions. The sweat that will result will mix with the bacterial overgrowth that has happened in this area because of poor hygiene in the first place, leading to even worse vaginal odor. Also, if there's poor hygiene, it entails that it is very likely that there are unclean clothing and unclean underwear also involved. Dirty and tight-fitting underwear will trap moisture, and these will create a favorable environment for bacterial overgrowth to occur. Therefore, as a part of good vaginal self-care, it's important to change your underwear regularly and wear cotton and breathable type of underwear. On this channel, there is a video which looks at vaginal self-care in quite a lot of detail. Refer to that video, which will help you maintain good vaginal self-care and therefore eliminate good hygiene being the cause of the vaginal odors that you may be perceiving. And finally, as it relates to poor hygiene being the cause of vaginal odors, improper wiping technique leads to urine residues and at times even stool residues in the vulval and perineal area. And these contribute to bad odors. Urine residues and urinary tract infections contribute to vulvovaginal odors also. Urine contains a byproduct known as urea, and urea contains ammonia. If there is an accumulation of urine on your underwear or an excess amount of urine in your vulvovaginal area, mainly because you didn't wipe yourself properly after passing urine, it will emit a chemical-like type of odor every time you lower your underwear because you want to pass more urine or open your bowel. You will sense this very strong chemical type of smell. And when I say a chemical type of smell, it almost smells a bit like bleach. And I think that's a good way of describing the urine residue type odor. Another thing to note is that strong ammonia type of smell coming from your urine itself can indicate that you are dehydrated. So keep an eye out for that smell, not just from your underwear, but from the urine that you actually pass in the toilet pan itself. Can give you clues as to whether or not you are dehydrated. So let's recap. If you smell that type of bleachy chemical type of smell, in essence an ammonia type of smell, think, am I dehydrated? Have I wiped myself properly after passing urine to ensure that there's no residue of urine on my underwear or an excess amount of urine residue in my vulvovaginal area? Think, could it be that I have a UTI? For older women who are gone through the menopause, who persistently perceive that odor no matter what they do, even if they wipe themselves properly, even if they're well hydrated, and they tend to be in the older age group, there may be an issue with urine incontinence. That's when they're leaking a little bit of urine by things like sneezing or laughing or coughing, or they get an urge incontinence. They've got to go and they've got to go right now, and sometimes they don't make it to the toilet and they leak urine. Again, if that's happening, you need to see your doctor because there's plenty of things that can be done to help older women who experience urinary incontinence. Now, onto the rare causes of vaginal odors that I promised I will discuss towards the end of the video. Now, these causes will give you a very strong, offensive, and even rotten type of smell that will make you want to do this. Literally. Smells so bad. But the distinct characteristic about this type of smell is that it is not only you perceiving it, but others around you are also perceiving this odor, even though you may be fully dressed. The first cause of this type of odor is a foreign body that has remained in the vagina for an extended period of time. These foreign bodies can be anything that has been forgotten in the vagina. So it can be a tampon, a condom, a swab, or literally anything that has been inserted in a vagina. Having a foreign body that has been left and forgotten in a vagina over time can actually cause an infection. This infection, if not treated promptly by removing this foreign body and giving this woman antibiotics quickly, can be life-threatening. This infection can lead to blood poisoning a condition also known as sepsis. And the only way to treat sepsis effectively is to remove the cause of the infection, which would be the forgotten foreign body, and follow this up with intravenous antibiotics quickly in order to save the woman's life. Many women, unfortunately, have lost their lives as a result of things like forgotten condoms inside their vagina or forgotten foreign bodies, like the tampon, which they never managed to identify. Having forgotten a foreign body in the vagina and not identifying and removing it promptly. I mentioned treating any resultant infection with intravenous antibiotic, but it doesn't always have to be that extreme in terms of giving you antibiotic through your veins. If it was left for a few days and there's no overall sign of infection, systemic signs of infection like fevers or, being clammy or your heart racing, but, it was identified and it was removed and the very strong meat, rotten type of smell was there, then you might be fine just having some oral antibiotic. But the take-home message is that if there has been a forgotten foreign body in your vagina, it is removed and you be prescribed antibiotics. Now, what I will say is if you have that very strong offensive smell, bacterial vaginosis has been ruled out, trichomoniasis has been ruled out, and it continues, you need to go to your doctor, but this time not just limit yourself to doing a high vaginal swab, but request to be examined, both with a vaginal examination with your doctor inserting the finger, but also with the use of one of these, which is a speculum that gets inserted into the vagina, stretches the wall of the vagina, and therefore the doctor is able to twist and turn it around to see if there is a forgotten tampon or condom, etc. So don't forget one of these if the strong offensive vaginal odor continues despite, being tested for other things and the results being negative for all the other causes. You must get a speculum done. Other rare causes of vaginal odors include rectovaginal fistulas. This is a rare condition in which there is an opening between the rectum and the vagina, leading to a leakage of stool coming from the rectum going into the vagina, and actually these women can start to leak out feces from their vagina. Obviously, this will give a foul odor. And also vaginal cancers and cervical cancers can give strong foul odors. And if your doctor uses a speculum and looks at the integrity of the cervix as well as the vaginal wall with one of these, after all the other causes of vaginal odors have been ruled out and we still cannot work out why the strong offensive smell is coming from your vagina, the use of the speculum will not only identify if there is a foreign body in there, but if a foreign body is not found, then we can take a sample from your cervix and swab along your vaginal wall, and that can be sent to the lab, or even better, you be referred to a gynecologist and a biopsy can be taken of the vaginal wall or of the cervix. When should you see your doctor? Well, you should see your doctor if the odor is associated with itching or burning sensation in your vagina, if you are getting lower abdominal pain in the lower abdomen or in the pelvic area, deep within your pelvic area, if you also experience pain during sex, whether deep inside of your pelvis or superficially in the vulval area, if there's any type of discharge associated with the vaginal odors, and finally, if you're getting abnormal vaginal bleeding. associated with the vaginal odor. So if you are a woman who's gone through the menopause, if you're getting bleeding with this strong vaginal odor, if you are a woman who is in your reproductive years and you're still having regular periods, if you're starting to experience bleeding in between your periods, just abnormal bleeding or bleeding after sex, and that's associated with vaginal odors, see your doctor. That's all I have for you ladies for this episode of Hey Doc. Thank you so much for watching. Remember, do consider subscribing, hitting the like button, and don't forget to share so that we can grow this Hey Doc health community. Thank you once again, and I look forward to seeing you in our next video.